I'm here today to talk to you about OHS as a fundamental worker right. I'm sorry I can't be there in person or online with you live. All right, so we're here to talk about OHS as a fundamental worker right. And as you probably heard from the presentations before us, we now have OHS established as a right. But what does this mean for unions, and what does this mean for workers? Essentially, there are two conventions that are attached to the fundamental right. And these two conventions, whether or not your government has approved or ratified these conventions, is irrelevant. These two conventions apply now to your countries if your country is part of the occupational part of the ILO. So now is the time for us to learn about our rights, and we have to think around what these rights are captured in these conventions, Convention 155 and Convention 187. So I'm not going to tell you the details about the conventions. You can go and read the conventions yourself and understand it, which I think you really should do. I think as unions, we need to sit down with the conventions and look at them, understand them in the context of our labor laws in your country, and have a look at it in terms of the practices of employers, governments, and the way that you're able to access rights. These all need to be looked at within the context now. So this is a good time to sit down as a union, look through it, and try to decide how you're going to work on these rights. So essentially, what the Convention 155 secures for unions is dialogue. So you have the right now to be consulted on national policy on occupational health and safety. That means government, employers, and unions, workers need to come together to talk about national policy, the formulation of that policy, as well as the review of that policy. And this must happen on a regular basis. So what is secured in this convention is dialogue with government as the state and as employer. Here we have, so Convention 155 says that governments must set up a national policy, and that policy is a framework of action, essentially to prevent accidents and injury to health. The effectiveness of that policy needs to be measured all the time, and we look for improvements achieved in preventing accidents and injury to health. We really need to think about how that gets measured, and this is also captured in the convention. So the other thing that the convention secures is training. So under the national policy, workers must be provided with training, including further training and skills on occupational health and safety. So this requires a state to have training programs on occupational health and safety, that there's adequate skills on occupational health and safety, and that training is provided at various levels, including enterprise levels, on health and safety. There is a reporting requirement. We, as unions, want to know, want access to information. We want to know about accidents that have taken place in the workplace, and we want to know about deaths that have occurred. We want to know about illness because of exposure at workplaces. these things are important, and the convention means now that we have that there must be procedures for notification on occupational accidents and diseases, and that countries must be moving towards annual publication on information of measures that they've taken. So statistics should be made available. Now, this is extremely important, especially in countries where we don't have information on how many people lose their life due to workplace accidents or health risks that they've been exposed to. So the other convention that is part of this basically complements Convention 155. So what that convention says is that there must be a national system and national program to promote continuous improvement to occupational health and safety. So it's no good just having a policy. There must be a program in place. There must be actions that will be taken. There must be objectives to this program. There must be priorities. There must be there must be timeframes for how things will be done. That is what a program means. This means that as workers and as unions, we can hold government accountable, and we can ensure that change happens and that there's improvement and better compliance, and workers are protected in the workplace. So for what the convention also says is that worker rights on occupational health and safety must be promoted. For unions, what this means is that you have the right to organize and campaign on OHS. You now can take up organizing on OHS, and you can speak to employers and say that you are promoting worker rights on occupational health and safety. This is something that you can do. So essentially, your right to organizing and campaigning on OHS is within the rights that have now been established. Essentially, what you have to do is now take up those rights. You have to go out and organize and campaign. And we'll look at some ideas around that now. So one of the things that you can do as unions is demand the right to know about safety hazards and health risks in the workplace. This requires negotiation. It requires workers to be involved in the process of risk assessment, etc. But actually, no, it doesn't. This is really an employer's responsibility. The right to know about safety hazards and health-place risk in the workplace actually falls on the employer. And so as unions, you have to negotiate and make sure that that employers are responsible for making sure that workers know the risks that they are in their workplace, and that they know how to take actions to mitigate those risks. That is an employer responsibility. So the right to that information is something that we need to organize workers on, and we need to negotiate with employers. The other right is the right to representation. We must represent workers because workers have the right to participate in determining safety measures at enterprise level, workplace level. We must have, in order to do this, the most effective way of doing this is to have OHS committees at the workplace. So as unions, we can now argue that in order to represent workers, there needs to be structures in the workplace, and we need to have occupational health and safety committees at the workplace to be able to represent workers and for them to participate in determining safety measures. workers know and understand the risk better than anybody else there. So workers need to say, yes, if we do this, we'll be safer. They must be part of that. It is workers' bodies that are and their labor that is on the line. So really, workers really do have the right to determining what is a safe, what is safe and what is healthy for them. Workers, as unions, we have to protect workers. We have to ensure that workers know that they have the right to refuse unsafe work. That is established in the C155, that you cannot, workers and worker representatives cannot be subjected to discipline, etc., if they've refused work because it's unsafe. And too often workers feel pressurized to take on work that is unsafe, and as a result they are subjected to risk that they went in knowing that they didn't feel safe to do this in the first place. So it's up to workers to make that decision, to decide what is good and healthy for them, what is safe for them, what is healthy for them. And if they feel that there is a risk, to say no to that work. The right to refuse unsafe work is something that we need to protect workers on and ensure that they understand and know that right. The other thing we need to do as unions is to fight for adequate and appropriate PPE. We cannot say that PPE is the last measure that is there. It's not the first, it's the last measure that is in place. It's the last thing. But PPE is very, very important. It must be appropriate and it must be adequate. And we have seen as public sector unions, we have lived through the pandemic with inadequate and inappropriate PPE. We know and understand what this means. The PPE is not something that an employer is giving to a worker. PPE is a right of workers. A worker is putting their body on the line to do this work, and it is up to the it is the responsibility of the employer to protect that worker and to provide the correct PPE for them to do the job. So these are, I hope, actions that will inspire you to think of what can be done as unions to now take up the right that has been won on occupational health and safety, and to start working on OHS as a fundamental right, taking this into your workplace, into dialogue with employers and negotiation, into your organizing campaign and campaigning activities. Thank you very much for your time, and I hope you have a very good webinar.